And the truth about tobacco is that it kills 1 in 10, it will account for 1 in 10 deaths. There's nothing pretty about what tobacco does to your body, but you wouldn't guess so from looking at these packs. So Japan, you can also adopt plain packaging, get rid of this packaging and tell the truth about tobacco. That's my end of it. That's my parting shot for you. Thank you.
Thank you very much indeed, Judith. As Judith mentioned, unfortunately, Japan could not make the announcement, but if you look back at the time of September 1920, we just had the new Prime Minister, so that we could not delegate the political leader at the UN General Assembly, which is something we need to fix first. But Dr. Mukitani was there as a Japanese representative at the UN General Assembly. Now we'd like to pass the baton to Loyce Pace, the Director of Health Policy at the Lance Armstrong Foundation, or Livestrong. And along with Loyce, I would like to introduce Vinci Gonzago. He's a Japanese head or leader of Livestrong, Lance Armstrong Foundation. Thank you for coming today.
Good morning, everyone. How are you? So thank you again for having both myself and Judith here today. We very much appreciate being able to share with you all our story of how we have come to work on non-communicable diseases, or NCDs, and what we hope to do moving forward. I think my presentation hopefully complements Judith's well in demonstrating what Livestrong has done as an individual organization in response to the global NCD crisis. So Livestrong is also a member of the NCD Alliance, as Judith noted, but we also have our individual mandate in response to the cancer issue and global agenda. But we saw that working in non-communicable diseases was important for our own mission in cancer control, because together we are stronger. That's generally our motto at Livestrong, and I think the motto of a lot of people in this room. And so we hope to align with the NCD community and lend our brand, our resources, and our expertise to help bolster that movement in order to advance not just the cancer agenda, but the broader NCD and global health agenda. For those of you who don't know, Livestrong is a nonprofit organization in the States. It was started by Lance Armstrong in 1997. He continues to be the chair of our board. However, we're governed by a broader board of directors, including people like Dr. Sanjay Gupta, people know him from CNN, and other leaders in health and medicine. Our CEO, Doug Ullman, is a three-time cancer survivor. There are about 90 or 100 people at Livestrong, and I would say at least 1/3 of those employees are cancer survivors. So we are very much focused on the survivor experience and representing the survivor experience. Our mission at Livestrong is to inspire and empower people affected by cancer. And this means all people affected by cancer. At last count, in about 2008, I believe, there were about 28 million people who have been affected by cancer, or cancer survivors worldwide. So, although our name is associated with one person, we believe that we're not just serving, obviously, that one person. We're serving all of these people who have been touched by cancer. This is a quote from our CEO, Doug, and it reiterates our focus on the survivor. So he says, we have always focused on the cancer survivor, providing resources, education, and one-on-one support. He goes on to say that in order to best support the individual, you must focus on policy change. So this is another reason we were very much involved in the UN Summit, because while we provide education and services and other resources for people at the individual or the community level, we also feel it is important to implement systems change, or more systematic, comprehensive overarching and wide-reaching change, i.e. public policy, in order to best serve an individual. And this is just a graphical depiction of that mission. So you'll notice at the center here is the cancer survivor. So the cancer survivor, again, is at the center of our mission. But out from that, in order to affect the survivor, we need to be sure to focus on the family or friends and the social network of that person. We then need to be sure to focus on institutions such as hospitals or organizations like other nonprofits, or even universities that could impact the experience of the survivor. And then going out from that, we want to be sure to foster some community support for survivors and finally, public policy that serves people living with cancer. Right now, I just wanted to go through some examples of what we have done at the global, national, and also local levels in terms of policy and advocacy. So this is an example from 2008. You'll see here, I think that's talking to Senator John McCain, who was running for the Republican nomination for president. And also you have a similar picture of Mr. Armstrong talking with now Secretary of State Hillary Clinton, who was also in line for the presidency of the U.S. And we thought it was important to try to convene presidential candidates to talk about cancer so that whoever won would be committed to cancer and to the cancer agenda and serving people with cancer. And I know that similar forums have been held here in Japan, so I just wanted to demonstrate that some of our work mirrors what is already happening here at a national level. We also had a more local campaign. So Livestrong actually is based in Austin, Texas, and given our position, our location in Austin, Texas, we try to advance policy at the state level there. And one thing that we did back in 2007 was we supported a piece of legislation that would allow for a fund for research to be created. And that was a proposal to create an initiative for $3 billion over the course of 10 years. And that award, or that fund, would then award $300 million in grants annually for research and prevention projects in cancer. We were successful in passing this legislation, and now California, Florida, Arizona, and other states in the U.S. are trying to replicate this initiative. Something else that we have done is we have been able to convene stakeholders at the global level around cancer. So something that Livestrong recognized a few years ago was that there were many activities happening in many countries and regions around the world. But those stakeholders had not been brought together to share their best practices and to learn from one another what they could do to improve on their work. So I think, as Gyoji mentioned, I was previously at American Cancer Society, and I had worked here in Japan, I had worked in India, I had worked in sub-Saharan Africa, and there were many organizations in those places that were doing very good work. But this Livestrong event was very important for them to all come together, and I know some people in this room were actually there. But I think it was important to bring all of those stakeholders together so that they can understand that they weren't alone. And I think that that was really one of the main objectives behind this particular meeting, was to lend support for all of those single advocates that might feel that they are going at this alone, but by meeting with other people, realizing that they shared so much in common with people maybe halfway across the world. Another major objective of this meeting was to raise the global awareness of cancer. So while cancer there's a higher awareness of cancer, say here in Japan, or say in Lesotho, there still wasn't this global understanding of the cancer burden worldwide. And so one of our goals was to really reiterate that here in Ireland. we were very happy to see 2 years later that there was this meeting at the United Nations that represented this higher global awareness of cancer. And we're more happy to work with the NCD Alliance, again as a member of that coalition, but also to be invited by the United Nations to speak at this meeting. So Lance prepared a statement and offered a statement as a cancer survivor in September, and really reiterated the need for any action to focus on the cancer survivor or the patient. Liz Strong also conducted a number of other activities in New York around the high-level meeting, and this was in an effort to support the efforts of the NCD Alliance. So again, even leading up to the UN summit, there was not really a strong awareness of this being an important problem. Cancer, diabetes, heart disease being a large global problem. So we wanted to try to change the minds, not just of policymakers, but also of the public. One thing that we did was we had a campaign in Times Square. And this was a result of gathering a number of Facebook photos that would then be included on a billboard in Times Square. And so we included this message around diabetes, lung disease, cancer, and heart disease being a global crisis. We called upon the world leaders to face up to it. We called out the importance of the Non-Communicable Disease Alliance. And we further had these cyclists biking around the city with the same message. But this video was displayed in Times Square throughout the UN General Assembly, so that not only the world's leaders, but also the general public would see the importance of this issue. We also had a number of events in New York at the time. This is Mayor Michael Bloomberg of New York City with Lance. And we were able to have an event at the Mayor's Mansion, again, to raise awareness around the meeting at the UN, but more broadly the importance of working on cancer and other non-communicable disease issues. So now, just to finish my talk this morning, I wanted to review a few of the global priorities that we have moving forward. They involve working on follow-up to the United Nations Summit, but they also involve some individual priorities of Liz Strong. So first of all, we think it is highly important to continue working on non-communicable diseases, again, because it provides a platform for us to advance the global cancer agenda. The work that we have done on NCDs doesn't simply end with the summit, obviously. As Judith mentioned, there's plenty of work to do moving forward. And also, as Judith mentioned, we don't necessarily want or need new programs. We need to build on what we are already doing. So one thing that Liz Strong is promoting is we're sitting down with the United States government to encourage them to use existing health systems to treat cancer and other diseases, other non-communicable diseases, and also use those existing health platforms to help prevent cancer and other non-communicable diseases. For example, right now, when you walk into a clinic, some clinics in South Africa, as a woman, you can be seen for having a baby. You can be seen and treated for HIV/AIDS. But that same woman cannot walk into that same clinic and be tested for cervical cancer, or be screened for heart disease, or receive insulin for diabetes. So we would like some of those same clinics to be used to treat that woman for all of these diseases. Finally, we are working still to help raise awareness of cancer and other non-communicable diseases in the country. So there is still limited awareness around the importance of these diseases that is often based on stigma or other a lack of policies or awareness, but we want to try to promote and otherwise support these local survivorship activities in countries to help bolster support for cancer and other non-communicable